That layer, lamina propria, is nothing like fat, and it's nothing like SMAS, and it's nothing like anything else. Coincidentally, when you put filler in there, it's the most similar type thing that actually fits into the lip coincidentally. So a gel filler, of which we have all these different types, fits in the best. Wednesday lesson of the day, we have a guest visitor here, Brandon Hefty Sanchez. So he's going to help me explain what we explained to a couple people today. Today's overwhelming repeated thing I think we saw was I explained to a couple people, they were asking what should I do about my lip, and I told them filler is actually the best thing to do. I just want to go over what the lip is made out of here, here, and here, and the three parts of the lip, what we place in it, and why one thing is more natural than the other. When we look at the lip, Brandon Hefty Sanchez, can you have a seat, please? Resident from Mexico, from Hospital Gonzalez. And he's here not of his own volition. He's on probation. They sent him away from Mexico and he had to come hang out here with us. Por favor, can you hold this? Ayúdame. Esta parte del labio, this part of the lip up here is called the philtrum. The philtrum, Philtrum. The philtrum is made of skin, which is epidermis on the top, dermis underneath, hypodermis, which can consist of fat sometimes, and then SMAS, which is like this, and then muscle, which is also like that. SMAS is a big contributor to this part of the lip. When we get to this part of the lip, we call this the vermilion. Vermilio, red, okay? That's the red part of the lip is the vermilion, which is red. There's the dry vermilion, and then underneath there is the wet vermilion. I tried to make an analogy today comparing wet vermilion to dry vermilion and comparing it to like Pakistan and India. The patient was a little bit lost, and I think it was an inappropriate comparison. But my point was they're very similar from the dry mucosa to the wet mucosa, and they actually have the same origins. Only difference is this is exposed out to the air, and inside is wet mucosa. It is not exposed out to the air. So that means that this part here is keratinized. Underneath it has a lamina propria layer, which is like this, and no submucosa, and then muscle. Whereas here in the wet vermilion, it's mucosa, no lamina propria, and a lot of submucosa underneath. Those are the three layers when we look at each side. So here is skin, SMAS. Here is mucosa, lamina propria. Underneath is wet mucosa, submucosa, which is all these salivary glands. When we're looking at these places, the place you can put filler when we're trying to augment lips is here in the dry vermilion. The place you could put filler for deflated SMAS is up here. So I did have a lady who came in here and she had a darkening all across over there, and she's never had anything done before on the lip. She doesn't really know anything about that lip except for it wrinkles when she puckers. Like that. When you look at it, there's a darkness there. The darkness is there because the SMAS has deflated, the hydratory layer, and the light doesn't reflect the same anymore as it used to. The color of the skin comes from the skin tone, skin color, skin pigment, the dermis thickness, the hypodermis, and the muscle underneath that. All those contribute to the light that goes down, reflects back to your eye, because light's absorbed deep into the skin. The higher wavelengths are, the rest reflect out. Either way, put filler in there or nanofat or anything to help reinflate that SMAS. When we're looking here and the wet mucosa, you shouldn't place fillers in the wet mucosa. The wet mucosa has submucosa underneath, which is just salivary glands. It has no confined space. So when you inject and it touches the wet mucosa, it just spreads everywhere. So you get bumpy and lumpy, and that's where you get all your nodules. Classically, Juvederm jumps over there. Juvederm jumps upwards, does all that kind of stuff. The other fillers can do it too with a bad injector. It's just more likely to do it with Juvederm than the others. Then you have here the dry mucosa. The dry mucosa I separate into three parts when we're doing injections. One is the vermilion or infravermilion. The other one is the body. The other one is the lower body or the wet dry border. Never injecting past that. So when we inject in here, we're injecting from here to here in a confined space, and that's all. We are ultimately doing fillers in the lamina propria. The lamina propria is this spongy, wet layer. It's glossy, it's wet when you look into it. That layer, lamina propria, is nothing like fat, and it's nothing like SMAS, and it's nothing like anything else. Coincidentally, when you put filler in there, it's the most similar type thing that actually fits into the lip coincidentally. So a gel filler, of which we have all these different types, fits fits in the best. So filler is actually the best thing to put in the lip. It's better than fat. It's different than nanofat. So if you ever do nanofat PRP, it would help stimulate the lip a little bit more in a different way. But as far as filler goes, that's the best way to go. Fat is yellow. Yellow doesn't belong in the lip. So if you ever put fat, you have to put very, very small amounts. Be very cautious with that. Otherwise, filler is the way to go, and that's really what belongs in the lip more than anything. So when people ask, like, I want something natural, they think that fat's natural. Fat in the lip, I've said it a million times, is not natural. You could put fat if you want to, but put very, very small amounts or use nanofat. Similarly, up here, there's no fat layer, so fat doesn't belong in there. So the most natural thing is actually this unnatural gel that we have. Now, within these gels, we have a lot of different options. Now, I have mainly Restylane here because that's mostly what I use. I use Juvederm for scleroderma and stuff like that. Sculptra does not belong in the lip, so you don't want to use that in the lip ever. You don't want to use Radiesse ever. You don't want to use Voluma ever. It's too thick. Juvederm you can use, but really tiny amounts. So then you have all these guys. What's the difference between all these different fillers? Restylane Silk does not do that well in the lip. It's very inflammatory. People use it for the lines that are in the lip. Restylane Lift, which is the old Perlane, does not belong in the lip. It's lumpy and bumpy. Restylane L, yeah, you could use it in the lip, but it's a beaded filler. You should use a small needle when injecting so it doesn't bead up. Either way, when you inject them all, they tend to disperse, but they can clump. So this is clumps a little bit more than these guys do. So here you have Restylane Kiss, which is in its own family, and then Refine, Define, which are in their own family. Refine and Define can be used in the lip. It's totally fine, just like Volura, Volbella. These are in the linear class of fillers, and Kiss is also in the linear class of fillers. So I tend to use this, Versa, or the Revinesse lips. I like them because they last a good amount of time, but realistically you can use this, that, Volura, Volbella, Revinesse, Versa, Teoxane, all those are fine for the lip, and it's totally fine to use. These are the best things to use, and I know patients want something that's permanent, but you have to understand that the lip is always going to change. So you might not want to put something permanent in a changing lip. It's also hard to control the injection, and I know that because I've injected things and I'm really good at injecting, and it still can move. And what happens if you put something permanent? It's going to permanently be where it accidentally went. So it's almost impossible to keep an injection exactly where you want it every single time. So if you're going to use something that has variability like that, it's better to use something that you can fix. So you can't fix silicone, you can't fix Bellafill, you can't fix Artifil, and those things are sclerosing agents, they're fibrosing agents. They tend to cause scarring in the lip. So does Radiesse, so do threads, so does Sculptra. The lips are soft, supple, lush, beautiful things. You should not put scarring or fibrosing agents in there. Fat can cause a lot of problems in the lip because it can change the color of the lip, it can make it bumpy, lumpy, it can move as you're injecting it, which we call spread. That can cause permanent problems. Fortunately, fat doesn't integrate fully, so you can actually get rid of it. So you can go into the lip and get rid of it either from here or from a direct incision. Silicone, however, does integrate. Threads, big no-no, big no-no. Like if anybody puts a thread here to lift the lip, it's not obviously that bad that it's malpractice, but it's malpractice. It's just the person's just an idiot. If they put threads in here, I understand the logic, which is you're thinking it's gonna help form collagen, but you're putting scar in the lip, and the lip needs to be soft. And the second you put something inflammatory along the vermilion border, you're exposing the person to risk of pigmentary change. And it's because you don't understand pigment. Pigment in the upper lip is not like pigment in the skin. Pigment in the upper lip is coloration that is a reflection of light going into the mucosa. It goes through the blood vessels, it gets absorbed by blood vessels, gets absorbed by the muscle, and then reflects to your eye. So anything that changes the blood vessels or the muscle or the reflection to those areas is going to change the color. Let's say you hold your breath and you hold it for like 5 minutes. Your lips are going to turn blue. It doesn't mean your pigment changed because there's not much pigment in the lip. So you're dealing with vascularity and musculature. And when you put something inflammatory there, you can change the lip because it tends to get patchy, you get hyperemic and all that stuff. So you see this a lot with Juvederm too, where they start to lose the color along the border. It starts to bleed, just like a lipstick bleed line. Unfortunately, when you dissolve the filler in that area, it tends to get better and great, and then you have to refill it. And then when you dissolve somebody in the lip, in the Philtrum or in the SMAS or in the lip, just realize you usually have to refill them because you're dissolving somebody who's been over overfilled most likely, which means they've been expanded most likely. That's like a microcystic expansion. It's like having a tissue expander in there for a long time, but not just one tissue expander, a million little tissue expanders that spread out the lamina propria and spread out the SMAS. And when you get rid of that filler, it collapses severely and you've lost your hydrotory potential and you're thinner than you even used to be because it just collapses. So in those patients, you do need to refill them typically after you do a dissolver if they've had it in there for a long time. So just realize that they have damaged tissue, you're not dissolving someone normal, and that's all. So hope everybody understands, even though we all want a long-lasting thing and a natural thing, the most natural appearing if you cut someone open is actually a very small amount of hyaluronic acid filler. And if you look natural inside, you look natural outside. That includes color, that includes function, that includes everything else. If you over-inject, you affect all those things, then they all get worse. Sign in.